Hello, everybody, and good afternoon. This is Trauma Talkin' 10. If you are watching this live or with the replay, please go ahead and comment below and let me know who is watching. I am Bonnie Barclay. I am the owner of Creekside Counseling and Wellness, a therapist here in Knoxville, Tennessee. And feel free to grab something to write down with in case anything resonates with you. And also, please feel free to check out the post on my Creekside Facebook page. I try to post things that go along with my Facebook Live each week. So this week I'm going to be talking about, or today, medical trauma. And so I want to start out with just really kind of giving you a definition of medical trauma, and then we're going to unpack it along the way. So medical trauma refers to a person's psychological or physiological response to a negative or traumatic experience in a medical setting. This experience may involve illness, injury, pain, invasive or frightening procedures, and or distressing or dismissive medical treatment. Even the conditions of the hospital environment, like constant noise, frequent medical checks, sleep disruption, these things may also feel intrusive or traumatic. So we're going to unpack this and have some things to consider. But I want to let you know that this is not like an attempt to put down the medical profession. I have such a respect for our medical professionals, especially on the heels of COVID and everything that we've endured. But whether it's intentional or unintentional, trauma does occur in medical settings, and I think we just don't talk about that enough. So I do want to unpack that today. So let me give you some situations to consider when thinking about what this means. Heart attack or stroke, childbirth and any kind of gynecological trauma, for example, an emergency C-section, preterm birth, NICU stays, any stays in the ICU for adults or children. So extended follow-up has confirmed that many patients suffer physical and psychological consequences of the ICU treatments, and that can last up to 12 months after a hospital discharge. PTSD in particular has become increasingly relevant in both the immediate and longer-term follow-up care of these patients. So what are some other things to consider? COVID and associated rules, which added to everyone's stress when we couldn't go in and be with our loved ones, or we couldn't have someone with us if we were experiencing a medical situation. HIV diagnosis, cancer diagnosis and treatment, ER visits, surgeries, dialysis, and accidents requiring intervention from first responders. Now, this is not all inclusive, but I just wanted to kind of get you thinking about some of these medical situations that can be traumatic. So medical trauma can take many forms and can occur in any level of care. It's not something that is limited to emergency departments or ICUs. These other levels of care include physicians' offices, clinics, residential settings such as nursing homes, any situation or setting where medical care is routinely given. So what are some of the symptoms of medical trauma? Persistent intrusive thoughts or memories of aspects of the medical event, so replaying the memory of getting the diagnosis would be one example. Significant distress when confronted with reminders of medical trauma. So for these folks, just follow-up medical appointments or going to any kind of medical provider may be triggering or traumatic or bring up those intrusive memories and feelings. So there is sometimes a disruption in treatment adherence or compliance due to trauma-related avoidance. So if you or a loved one find yourselves avoiding these important medical appointments, I think that's something to pay attention to. On the opposite end of this is overutilization of healthcare. So health-related checking behaviors because they're anxious and worried maybe of something bad happening again, so they're going repeatedly to the doctor or emergency room for reassurance. So all of these things can impede recovery, which is why treatment or support around these things are so important. So how common is PTSD following medical trauma? It is common and expected for patients to have some difficult reactions in the days or weeks following a medical trauma. Those reactions usually decrease over time for most patients and resolve on their own. Our brain has the natural information processing system that moves towards health most of the time. It's when it gets overwhelmed that things can get stuck and that we need some support. So an estimated 80% of ill or injured children and their families experience some traumatic stress reaction following a medical trauma. Between 20 to 30% of parents and 15 to 25% of children experience persistent traumatic stress. Among adults, estimates of traumatic stress reactions vary depending on the type of the event. Approximately 1/3 of traumatically injured patients experience PTSD or depression post-surgery or post-injury, Approximately 20 to 30% of ICU patients experience PTSD symptoms. So let's take a look at some factors that may affect a person's vulnerability to medical trauma. A pre-existing mental health diagnosis, some perceptions about the quality of care, the level of trust in one's medical team, and factors related to the overall treatment like length of the hospital stay. Research shows that the sensitivity of the medical staff is an important factor. When care is not patient-centered, empathic, and sensitive to the patient's emotional health, patients can suffer as a result. So that is a really important piece there in terms of self-advocacy, in terms of our own care, and maybe advocacy for our loved one for that patient-centered care. The sensitivity of a professional's communication plays a central role in how people experience traumatic medical events and how they cope. So let me repeat that. So the sensitivity of professionals' communication plays a central role in how people experience traumatic medical care. So we can mitigate the impact, soften that impact of traumatic events just by showing up. You know, I talk about this in some of my other talks about co-regulation and the support we can provide by just being present in a caring and co-regulated way. The same thing occurs when we've experienced a traumatic event, even in the medical setting. So children may be in an elevated risk due to developmental vulnerabilities, lack of control, or limited understanding of what's going on or what's happening to them. Parents watching as children endure medical interventions, many of them feel helpless to protect their child from suffering, and therefore they can also be at high risk, also feeling out of control. Anyone undergoing a high level of stress at home, at work, school, or within key relationships are also more likely to experience medical trauma. As providers, it's important to understand a patient's history. This is a critical step towards avoiding trauma reactivation and patient re-traumatization. So said in another way, we want to tell medical professionals our whole story, including any history of trauma, any mental health diagnosis. That way they can show up in the way that we need them to. It helps them be successful, and it helps us get the care that we need. It is important as professionals to ask those questions, not just focusing on the medical problem presenting for treatment. As individuals, it's important to communicate this. If we go with our loved ones, one of the things I'll mention in a minute is showing up for our loved ones, going with someone offering support. Because sometimes, even when we go into a doctor's appointment, I know I get overwhelmed, or was with my kids. Sometimes I would write my questions down so that I remembered what to ask in those moments of overwhelm. So while many settings and experiences can trigger stress for people with medical trauma, people who've already experienced it, some common ones are doctors' offices, dentists' offices, especially for children. Parents, I want you to know that if your child has any experience with medical trauma, to have to lay down on their backs in the dentist office and have people kind of hovering over and doing things to them, it can equally be traumatic, even though it's another setting. So it's important to provide that history also to dentists and other medical professionals, optometrists, wherever they may be kind of hovering over in a way that might mimic their medical trauma. Any place with bright lights, being touched, specific scents like the scent of a disinfectant, these can be triggering. All of our senses are involved in the trauma, and so all of the senses can be vulnerable to triggers. In terms of communication and self-advocacy, again, I want you to consider 4 key areas. Communication by the provider, any physical discomforts that are going on. These are things that you want to talk to your provider about. If you don't feel like they're sharing the details that you need to feel comfortable, or they aren't sharing it in a way that makes you feel comfortable, then speak up. If you're experiencing physical discomfort during any medical care, while it may be something that you have to endure, you don't have to suffer alone, and you don't have to endure without the support and empathy of another person. And maybe they can do something to make that better for you. I do think we kind of have this pull yourself up by the bootstraps mentality that we must endure in medical situations. So any environmental discomforts, to communicate those and see if they can be resolved. And your emotional experience. Again, typically the physical needs that take precedence, right, over our emotional needs, eclipsing those mental health needs of patients and their family. This is understandable that the physical health is a priority in those settings. However, we need to do better assessing and responding to the emotional experiences as well. Many people, again, suffer in silence. We're socialized to endure medical treatments, like I was talking about. And often we expect ourselves and others, especially adults, to just deal with the emotional effects. We ask, how is your pain? Any side effects of the medications? Rather than also inquiring about fear, sadness, worry, and other emotions people face as a consequence of their medical event or illness. The providers do not know what you do not communicate. If you communicate and you do not get the response you or your loved one needs, speak to someone. Ask for another nurse. Ask for a social work consult. Hey, social workers are in the hospitals. Chaplains are in the hospitals. There are people there that want to listen and support you, and I don't know if you're aware that they're there. Ask for them. When possible, help patients prepare, whether that's your child or loved one, for an upcoming hospital stay by providing tools and resources to help patients learn how to better manage stress and anxiety. If someone says no to something on your coping plan, it is okay to ask why. Yes, it is okay to ask why. Is there problem solving that can occur? Possibly. I had a sweet client who wanted to take her stuffed animal with her. And she was an adult, and that was not seen as something that she needed by the medical professionals. We prepared for her surgery, and she was able to ask why. She was then able to ask for a new nurse to support her in her process. And by golly, that stuffed animal was dressed up and was brought in as a comfort to her during this procedure. Sometimes we just have to speak up. Consider again bringing someone if you need them. In cases when patients experience medical trauma as a result of an unforeseen medical crisis, like I said, clinical social workers and mental health counselors, whether in the hospital or after discharge, can intervene and provide services. So here's the hard truth for today, and I know I said 10 minutes and I'm being long-winded today. Can you tell I am passionate about medical trauma? I have to admit it. Sometimes trauma occurs in situations that are easy to recognize, like natural disasters, abusive relationships. We see those. But the hard truth is that other times it happens in places that we go to get better, like hospitals, doctor's offices, and urgent care facilities, and even first responders that are supposed to be there to help us. They still have to intervene in ways that sometimes can feel intrusive or overwhelming in the moment, and we discount that because that's what they had to do. Both can exist. We can both see that they needed to do what they needed to do, and we're allowed to have feelings about that we need to unpack, right? So for people who've experienced some form of medical trauma, it can bring up a lot of conflicting feelings, as I just mentioned. Hold both. That sometimes eases that sense of conflict when we allow ourselves permission to know the facts and have the feelings, even if they're conflicting. So the takeaway for today is to be an advocate for yourself and your family members. Know that help is available. And EMDR is an effective approach to treating medical trauma. So no matter where you are and who's watching this, just know help is available. You do not have to suffer alone. If you need help with a referral in your area, please message me. I will be more than happy to help you get the care that you need. Have a good day, and thank you with your patience for me being 10 minutes over. So talk to you soon. Bye.